One of the most misunderstood topics in wellness, especially today, is weight loss. You've probably heard hundreds of conflicting messages about calories, carbs, hormones, or willpower. And when we look through both functional medicine and traditional Chinese medicine lenses, a much clearer and much more compassionate picture emerges. I'm Dr. Cynthia Clark, and in functional medicine, we don't start with the scale. We start with symptoms. Weight gain isn't a failure of discipline. It's often a signal from the body, a sign that one or more of your core systems, metabolism, hormones, digestion, detoxification, or stress is out of balance. Here's what we look at. Insulin resistance. This is when blood sugar stays high too often and the body stores more fat and burns less. There's also inflammation. Chronic stress, poor sleep, or food sensitivities can trigger inflammation that slows metabolism. And then mitochondrial function, your cellular engines. When they're tired or overloaded with toxins, energy and fat burning both drop. And there's your gut microbiome. Your gut bacteria influence hunger, hormones, cravings, and even mood, all of which affect weight. So in functional medicine, the first step isn't restriction, it's restoration. We balance the system so your metabolism can start working again. And in traditional Chinese medicine, we see weight not just as a number, but as energy that's not moving properly. When the body is in harmony, qi flows. Digestion transforms food into energy and fluids circulate freely. When it's not, energy gets stuck. And that can look like weight gain, bloating, fatigue, or swelling. Here's how it breaks down. Spleen qi deficiency, because the spleen governs digestion and transformation. And when it's weak from overthinking, sugar, or cold raw foods, dampness builds up, what we might call metabolic sluggishness. Then there's dampness and phlegm accumulation. This is the TCM version of stored inflammation or stagnation. The body holds on to heaviness and moisture. There's liver qi stagnation, when stress and emotions block the flow of energy. It disrupts digestion and metabolism. And there's kidney yang deficiency, the root of energy and metabolism. When the kidney fire is low, the body feels cold, slow, and resistant to change. So where Western medicine says slow metabolism, Chinese medicine says low qi and damp accumulation. Different language, same insight. When we combine these two perspectives, the data of functional medicine and the wisdom of traditional Chinese medicines, the results are so powerful. We can use labs to identify insulin resistance, inflammation, thyroid issues, or gut dysbiosis or hormone imbalance. And we can use TCM pattern diagnosis to understand whether your body needs drying, warming, soothing, or tonifying. Pair the two for a plan that's truly personalized. For example, a client with high cortisol, sugar cravings, and bloating might show liver qi stagnation and spleen dampness in TCM. So we use herbs or acupuncture to move qi and clear damp, and pair that with functional support like blood sugar balancing, protein timing, and mitochondrial nutrients. Ultimately, weight loss isn't about losing something. It's about freeing energy. When we restore balance, physically, chemically, and energetically, the body naturally moves towards its ideal state. You don't have to fight your body. You can learn to listen to it. That's how healing happens, and that's where true vitality begins. If you've been trying to lose weight and feeling stuck, maybe it's time to look through a different lens. In the Decode Your Dolphin program, we help you understand your metabolism type, whether you're a walrus, a sea turtle, or a silky shark, and create a plan that restores flow, balance, and energy. I'd love to help you discover your metabolic blueprint and begin your own transformation. Until next time, keep breathing deeply, eating mindfully, and remembering that balance is the real secret to lasting change. I'm Dr. Cynthia Clark, acupuncturist and nutritionist.